How fat transfer saved my butt? Well, it's happened a lot of times during explant surgery. One of the problems with explant surgery is when you remove the implant, that old pocket wants to collapse, and that can cause things like indentation or even nipple inversion or post-explant breast deformity. One of the ways to improve is to do a breast lift at the same time, but sometimes that's not enough. Like on this patient, she had an old mesh that was sticking through the skin after multiple operations on the right breast. And by the time I removed that mesh and the implant, she was missing about 1/4 of the breast. There was a larger implant on that size. And it reminded me of something you see almost with breast reconstruction. So what I did was harvested fat 360 from her abdomen, her love handles, everywhere I could get it because she's thin and fit. And I injected most of that fat onto the right side to help rebuild that shape and get near symmetry with the left side. Fat saved my butt with this patient as well. But this patient, I did the fat transfer as a second stage over a year after her first surgery. Her implants were high and painful and she wanted them out, and we did a breast lift. But one of the other difficulties with implant removal surgery is as the pocket collapses, it tends to pull the breast fold up. And as the breast fold gets pulled up, it's hard to determine where to put your scars or how things heal. One of the ways I try to figure out where to put the scar on a patient when I remove their breast implants is I remove the implants before designing the complete scar, and then I sit the patient up in the operating room. When they're seated upright, it helps me determine where their breast fold is as I collapse the pocket with drains and stitches. But over time, that pocket continues to collapse further even after the drains are pulled. And you can see on this patient initially, a couple weeks after surgery, it looks like I'm close to where I think her breast fold is. It's risen up quite a bit from her original position. But after several months, I can see that the pocket's continuing to collapse and pulling that fold even higher. So this patient also had some irregularities on the bottom pole of the breast and just not a perfect shape. So she came back a couple years later and I harvested fat from the abdomen, love handles, and transferred that fat, revised the scars for a much better shape as a second surgery. Now you don't need fat transfer in a lot of patients that want their implants removed. This patient's young, she's got very good skin tone, she has smaller breast implants, and just with an explant surgery and a breast lift, I was able to really shape that upper pole and give her a really good breast shape. But a lot of times patients end up more like this patient, who you can see she ended up with a little bit more of a droopy shape at the end because the skin tone isn't as good. She had a lot more upper pole fullness right after surgery, but lost that with time. It's hard to preserve that upper pole fullness with explant surgery. And this patient's an example of a little bit more of an extreme. Big implants, not a lot of breast tissue, and you can see that concavity on the upper pole, and now she's really hollow up top. It's not bad result for an explant surgery, but it could have been better with fat transfer. And this patient's another example as well. No fat transfer here, looks okay, 300 and something cc implants removed, but from the side you can see that concavity on the upper pole. Now compare it with this patient who had a 600 something cc implant, almost twice as big of an implant, but she allowed us to harvest fat from the abdomen and love handles, and you could look at that upper pole from the profile view and compare those two upper poles, one without fat transfer, one with fat transfer, and you can see how much that upper pole has been volumized with the fat transfer and how much it helps. Now with some patients, it's a no-brainer to do fat transfer. They want to have liposuction, like this patient. She wanted to have a scar revision of her abdominoplasty and liposuction at the same time. So if we're going to perform the liposuction, why throw away that fat? We can help add it to the breast to help volumize the breast at the same time. Or like this patient, she had prior liposuction of her abdomen and she always wanted liposuction of her love handles. So we really focused more just on the love handles, harvested fat from the love handles, did a breast lift, removed the implants, and helped volumize and shape the breast with the fat from her love handles, which she was more than happy to get rid of. Now, even if you're a thinner patient, you can still have fat transfer, like this patient, who's very fit and toned. I performed liposuction 360 of the abdomen, love handles, and thighs. She had large implants over 400 cc's. That with a breast lift revision, fat transfer gave her a pretty good shape for explant surgery. This patient as well, very thin, in shape, proportionally large breast implants, never had liposuction before, performed fat harvest from her body 360 degrees, everywhere we could find the fat. With the breast lift, overall, I think we got a better shape without breast implants. Now, fat transfer is something that has risks and benefits, and these are things that you really have to discuss with your board-certified plastic surgeon before making a decision to do so with your explant surgery.